So I've received a letter from the endocrinology department, which is sent to my local GP, NHS. I thought I'd read it out because it's a bit funny, really. So diagnosis on exogenous testosterone via private prescriber, yes. Suffers depression, yes. Previous torn bicep, blah, 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 blah. Action for GP. I have advised Mark that we need to reassess his access to see whether he qualifies for testosterone replacement therapy on the NHS. How many more tests do you need? I've been getting tested for 14 years. Not just by the NHS, but by my previous clinic, the clinic that I'm with. How many more do you need? He understands that he must come off his testosterone for us to be able to assess this. Yeah, and I'm fuming about it. I'm not going to do it. Why? Why do you need me to do that? I am grateful to you for performing 9 a.m. blood tests. And that's just not me reading like an absolute spud. That's how they've written this. I am grateful to you for performing 9 a.m. blood test. I don't know, is the woman, is she from Thailand? I don't know. Test at your surgery in 2 months' time. A request for this has been put on ice, and Mark knows that he should call my secretary when he has had these tests done so we can discuss the results. I never got told that. I am grateful to you for referring Mark for a sperm count. Unfortunately, this is something that I am unable to do from endocrinology, as it is tertiary service. This is to be sure that his testosterone therapy has not rendered him infertile. I'm on HCG. You know I'm on HCG. I've told you I'm on HCG. We all know what HCG does. It keeps you fertile. Plus, since I've been on TRT, I've conceived. I've got a daughter now. What more evidence do you need? I'm getting confused there. It's crazy. Mark has a long-standing problem with low mood, which he pills has. See, that's them. First of all, right, if you're a doctor, are you going to proofread what you send before you send it? I know I would. I'm guessing that this doctor as well sends prescriptions off. So if they're not proofreading what they're sending off, that worries me a bit. That really worries me. So she can't even proofread what she's writing, so she's writing a load of gibberish to my GP. What if my GP does the same? She writes gibberish about the gibberish, and there's like Chinese whispers, and by the time it gets back to me, I'm like, what the hell was this? It's just absolute mental. I have explained to him today that my concern is that the testosterone is masking his symptoms rather than necessarily replacing a true testosterone deficiency. I didn't get that at all. I have explained to him today that my concern is that the testosterone is masking his symptoms rather than necessarily replacing a true testosterone deficiency. So what do you do when someone has a true testosterone deficiency? You give them TRT. So what are you going to give me, this magic thing that's not TRT? I would be grateful if you could check in with him regarding his mood in a couple of months' time. Well, if I come off TRT, in 2 months' time, I'm going to be fucking fuming. I'm going to be probably nearly suicidal, I would have thought, because I'm feeling quite down at the minute. If I come off TRT, I know TRT doesn't help everything, I know that, but it's a good baseline. So, you see me in 2 months' time, you're getting it. Recent results. There was no NHS test done to assess his reproductive access prior to him starting on testosterone that I can see available on our system. You did kindly include some tests from the private provider, but these dated back to February 2020. So this is over 2 years ago. This showed that he had a normal free testosterone of 0.231 with a total testosterone of 9.5 and a low SHBG of 21. I can see that he had a super therapeutic testosterone level in January 2022. So what does super therapeutic level mean? I think it means you're on too much. I've never been on too much. I've always been within range. So what are you on about? With a free testosterone of 0.79 and a total testosterone of 26.5, look. How is 26.5 a super therapeutic dose? It's not. If you're over 30, that's when it starts getting into super therapeutic. What are you on about? What is this person on about? He has had consistently suppressed levels of his LH and FSH, which indicate that he was being over-treated by the provider supplying the testosterone. Now, I don't know everything about TRT, but people that are on TRT always get advised that your LH and FSH are always going to be slightly raised. If you can get testosterone and those two things aren't raised, As far as I'm aware, that it just doesn't happen. If I'm wrong, please let me know. Details of consultation. It was lovely to meet Mark, that is my name by the way, nice to meet you all, in clinic today. He is a 34-year-old, blah blah blah, who has a 6-month-old child, blah blah blah. He tells me that his problems first started when he was around the age of 20, when he started to develop symptoms of brain fog, depression, low libido, and some erectile dysfunction. All true for once. She ain't got anything wrong there. He was started on antidepressants, which can of course also cause problems with libido and erectile dysfunction. Also true. Around 2.5 years ago, he had mind you, I had those problems before I got given antidepressants. Around 2.5 years ago, he had a telephone consultation with a healthcare provider called Optimal. He was never seen in person, and they performed some tests via a private lab. These showed that although his testosterone was within the normal range, as was his free testosterone, they were towards the lower end of normal, and then they recommended him to be treated privately with testosterone and better HCG. All true. He has been taken then since. He is currently on alternative days subcutaneous regime. All true. So that was all true. They've got that right. They're just stating facts here. This is what I've told them. I can see that he was clearly overtreated with a free testosterone of 0.79 back in January, and I believe his dose has since been reduced. No, it's not been reduced at all. I never told you that. I never told you that. The reason my levels have come down is because I switched from shallow intramuscular, I always struggle to say that, shallow intramuscular, to subcutaneous fat. And my body's just not accepting it that way. It's not, my body's not absorbing it that way. That's the reason my levels come down. I've told you that. I haven't switched to anything. My dose have not come down at all. Fucking, where are you getting this from? Since this dose reduction, not true, was made, he has had a recurrence of some of his symptoms. Yes, I switched to subcutaneous. That now my problems are coming back, not because I recently reduced my dose. However, I do know that his present free testosterone is towards the upper end of normal range at 0.54. Right? What's your problem? Mark is struggling to pay for the private prescriptions, yet he tells me that he does not think that at any time his pituitary hormones, LH and FSH, were elevated, and I could not see any results from these on the information that was provided. What? I never said that. Clearly, if Mark has genuine testosterone deficiency, what, am I lying, am I? Do my tests lie to you? My blood tests, which I'm getting taken, are they false? Are they fake? Did I buy them from Thailand? No, I didn't. The question is whether this is from primary testicular failure or as a result of his pituitary glands having issues, and none of this has been properly explored. Why? It's been 14 years I've been trying to go through this. It's taken you 14 years to have that sentence laid back to me, is it? It's absolutely mental. I'm fuming with this. So they should have explored that years and years and years ago, should they? It's took him 14 years to discover that. In order for him to qualify for testosterone replacement therapy on HS, we would need to demonstrate a genuine testosterone deficiency on our validated labs. I'm not going to go into that. I think the best thing for us therefore to do is stop his testosterone and to simply repeat his bloods in 2 months' time with a 9am blood test to see where his levels are sitting. I can see where they're coming from, I can. But if I've gone to the doctor, told him I'm depressed as it is now, you want me to completely come off TRT and probably feel twice as worse than what I feel now? Do you really think that's safe for me? Do you really think that is safe and healthy, not just for my body, but for my mind as well? It's not. I can tell you that. I can tell you that it's not, and I told you that. If this shows that he has testosterone deficiency, then we should evidently replace his testosterone. Evidently, yeah. But also investigate why this has happened. Why hadn't you investigated this when I first come to you when I was 20 years old? I'm 34 now. However, if he does not have testosterone deficiency, how many more tests do you need? Then I cannot recommend him for treatment on the NHS in accordance with our Endocrine Society guidelines. Mark understands that lots of people will feel better when they take higher dose of hormones. Do I? This is coming from many hormones, including steroids, thyroxine, and testosterone. However, because of the long-term effects of these medications, we cannot recommend them as primary treatment for mood or deliberately altering physique. Right? Mark has been on better HCG as well. Mark has been on better HCG as well, and on examining him today, his testicles were of normal volume. Yeah, thanks for that. And he was appropriately viralized. As testosterone can cause infertility through suppression of FSH, I'm on HCG, so it doesn't matter. I would also recommend that he has a baseline sperm count. I've got a daughter. I was on testosterone replacement therapy for 2 years, then I had a daughter. I'm not worried about my sperm count, you are. Please see my notes above. Many thanks for referring him to this. I have explained to Mark that the preparations of testosterone that were available on the NHS are either free monthly libido or a daily testosterone gel that he would apply himself. He has a lot of concerns about this. Fucking right I do. He has a lot of concerns about this and has spent a lot of time on the internet investigating different testosterone options and has had a lot of patient testimonies on YouTube, haven't we? And on other platforms stating that they are not happy and have a side effects and these preparations. I've obviously explained that the unhappy patients are very likely to be overrepresented on the internet. Is that obvious? Is that obvious? Can I just read that again? I have obviously explained that the unhappy patients are very likely to be overrepresented on the internet. Is that right? Is that right? Or is it just normal blokes that I'm chatting to which are getting fucking neglected by the NHS? And I'm getting testimonials from actual real studies out there on the field. You get studies from these little laboratories on from like test results and things which happened probably like 30 years ago. You're getting your information from. I'm getting my information from people who are suffering now. Thousands of you. Well, not that many. Not that many I speak to, but I know there's thousands of people out there that are suffering. Oh, fucking obviously explained. This is exactly what we've got to deal with at the minute. But there is no perfect option. There is a perfect option. It's called cypianate and it's called enanthate. They are the perfect options. Sorted. We would also not routinely give better HCG. Why not? And this is not something that I have available to me in my practice. Well, go get some and I'll give you the money for it, alright? How does that sound? I'll give you double. Therefore, that if we are recommending starting on testosterone, he would be well advised to opt for sperm storage, so, blah, 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 and then it just ends. So not only did she not proofread what she sent me, she didn't even send me all of it. I mean, what do you say to that? What do you say to that? You're just shit. You're shit at your job. I'm sorry. You're shit at your job. What is this? What is this? So there we are. If you need proof that we're getting neglected, it's all in this letter. All in this letter. Not only can they not proofread what they're writing, but they don't even finish sending it to you what they have said. So I don't even know what she's fully said to my GP at the minute. We're fighting a losing battle here. But I'll keep fighting no matter what. I will keep fighting because I know there's people that are on Sustanon at least on the NHS. But there we are. That was a long video, but this is the type of thing which hundreds or if not thousands of people are dealing with. And let's keep that good fight going.